Nothing like the more rigorous chemotherapies. And that I could take at home for 6 months and normally be able to live quite happily with that. It wasn't a question of why me, really, in your 60s, why not me? So it was never a drama. You know, people think, cancer, I'm going to die. And it's just, with this one, I sound like an ad, don't I? It's not the case. You're worrying that you've got cancer, go get it checked out because it's highly unlikely that it's cancer. And if it is, I mean, quite clearly, and everyone knows that the sooner you get the symptoms checked out, the better. And even if it does turn out to be cancer, particularly with this cancer, it is so treatable. I am more aware of staying in good nick and not letting, that really it is up to me what the rest of my life is like. If you help yourself along and keep fit and do the right thing, then the setbacks you're more likely to get through than, and so I've learned that a lot of it's down to you, down to me.
I'm Dr. John Bennett, and I'm the chairman of the charity CORE, which raises money for research into the whole of gastroenterology. That's the whole of the gut and the stomach and the liver and the pancreas and all the bits attached to it. A stomach ulcer or a peptic ulcer in either the stomach or the duodenum is a breach in the normal lining of the stomach or duodenum, like a hole. And they're not dissimilar from the ulcers you get in your mouth. When should you see a doctor with indigestion? Well, we all get indigestion occasionally. If we eat too much or drink too much, then once in a while we'll get some heartburn or some soreness, and it serves us right. But if you get symptoms recurrently and similar symptoms over and over again, especially the more severe pains in the top of the stomach, then people should certainly see their doctor and ask for advice. The main symptom of a peptic ulcer is pain, and it's usually very localized where the V of the ribs is. It may go through into the back or a little bit up into the chest. Now, sometimes ulcers don't have any symptoms in the form of pain, and they may first be noticed if the patient, for example, bleeds from them, either vomits blood or passes changed blood through their back passage. But one thing that people with any indigestion need to be careful about is if they choose to take drugs such as aspirin or more powerful pain relievers, those have a damaging effect on the stomach and duodenum. And if these people are inclined to have an ulcer or do have an ulcer already, these will only make it worse. If they have pain of that variety and it comes back more than once or a few times, then of course they'll need to see their doctor about it. And then if it sounds to the doctor that they are the symptoms of an ulcer, he will have the choice of investigating it or to test the patient for the presence of a microbe or germ or a bacterium called Helicobacter pylori, because they're almost always present if in a patient who has an ulcer. The doctor, believing that this may be due to an ulcer, then can either arrange for the patient to have the stomach and duodenum looked at, or they can simply test for the presence of Helicobacter pylori. If it's there, then eradicate it with a combination of antibiotics and an acid-reducing drug, and then if the symptoms go, you presume it's been an ulcer. Occasionally, similar symptoms are due to more serious conditions, such as, for example, a cancerous ulcer in the stomach. And that can easily be differentiated by one of these tests with an endoscope, when the abnormality can be looked at and specimens taken from it using a pair of tiny forceps. When a course of treatment is given, it's essential to follow it accurately and carefully and fully. And that's especially true when you're treating Helicobacter pylori, because if the doses are cut short or reduced or missed out, then it's quite likely that this very difficult bacterium will be resistant to the treatment and the treatment will fail. If a patient is told that he or she has an ulcer, there's no reason for great anxiety about this, because they are very treatable these days, and especially they're treatable by relatively simple means with tablets, and the likelihood of needing an operation is very remote. 30 or 40 years ago that wasn't the case, and it was a much more serious matter. But today, while it can't be regarded trivially, it's certainly not a matter for great concern.
I'm Dr. Rob Hicks. I'm a GP working here at the Randolph Surgery in London. The usual symptoms of tonsillitis are a very painful throat and often a high fever. Some people get a headache, ear pain, a cough, and it's often really difficult to swallow anything at all, food or liquid. Now, when somebody sees their doctor, the doctor will ask them about their symptoms. They'll want to examine their neck for enlarged glands. They'll want to look in the back of their throat to see if the tonsils are red and swollen and inflamed. And often the tonsils are covered in white pussy spots, which helps form the diagnosis that what they've got is tonsillitis. Those who are at most risk of developing tonsillitis are children and young teenagers. The reason behind this is their immune systems are developing. Plus, of course, they're often exposed to many different infections. As we get older, the role of the tonsils diminishes, and so we're less likely to develop tonsillitis. It's much less common for somebody to have their tonsils removed, called a tonsillectomy. The reason behind this is that the research would suggest that actually there's very little to be gained in somebody having their tonsils removed. Although initially, after the tonsils are removed, a person may suffer fewer throat infections in the first 2 years, after that, they're likely to suffer the same number of throat infections as somebody who hasn't had their tonsils removed. Add into that equation the fact that it's an operation, so with any operation comes inherent risks, the risk of a general anaesthetic, the risks of pain and infection afterwards. And notably with a tonsillectomy, there's a risk of bleeding afterwards, which is why nowadays, where possible, surgery is not performed or recommended, because in time, people will grow out of this condition. If your child is suffering with tonsillitis, then of course tender loving care is very, very important. You can bring down a high temperature and relieve the pain of a sore throat with the appropriate dosage of children's paracetamol or ibuprofen. Remember never to give aspirin to children under the age of 16. Of course, offer them plenty of liquid to drink, offer them food that they can tolerate, and if you're worried about your child or if their symptoms don't appear to be getting better as they should do, then never hesitate to seek medical advice.
My name's Lindy Waldron. I've just had my 58th birthday, and in April 2004 I was diagnosed with ovarian cancer. My reaction was complete shock. I just went into sort of complete numb shutdown, really. It was like being in a fog and like having a sort of heavy weight around me, and I just couldn't see through it, I couldn't see round it. I could only just focus on one thing, which would be an image of me fading away. Although I'm a district nurse, and I should have known that what I was experiencing, the symptoms I was experiencing, were not just due to stress. I had so much going on at that time that I kind of ignored it. as women do. They have odd pains and they just put up with it, and you just carry on. I was working full time, and I did rather ignore it, and I did rather leave it late, which I feel embarrassed about. I had surgery, I had the mass removed, I had all the gynae bits removed that you would expect, and unfortunately the cancer had spread to my spleen, so I had to have my spleen removed as well. So it was a big operation, and I am now on antibiotics for the rest of my life because I'm prone to infection. I had 6 sessions of chemotherapy after the surgery, which was quite aggressive. It needed to be aggressive, and they did warn me that there would be possibly long-term side effects, which I've had problems with. I lost the feeling in my toes and my fingers. The feeling in my fingers has more come back now, but my toes are still fairly numb. Chemotherapy, I was surprised how it wasn't as bad as I thought it would be. It wasn't pleasant. It was just something that you had to get through. You knew that you had to get through these 6 cycles of treatment, and that you would have times when you were not feeling well, you would have times when you were feeling really well, and in between you're probably just very tired. But it wasn't as bad as I thought it would be. A lot of it goes in a blur. You don't really... I did keep a diary, which is fascinating to look back on, and that's also a very positive thing because I can see how ill I was, really, and I probably wasn't aware of it at the time, how ill I was, how strange I looked, because the steroids make you very bloated, and I had no hair, so I did look strange, and I did have a wig for a short time, which I probably think wasn't a good idea, but everyone was very polite and said it looked nice. I wrote in my diary, and this is what I actually wrote. I feel fat, freaky, unattractive and clumsy. And that was how I felt. Keeping the diary was very good. And another piece of advice is whenever you go for an appointment, take somebody with you, always. Or get whoever's talking to you to write it down. Because when you go for your appointment, you might remember the first 2 sentences, and after that, if it's something that you didn't want to hear, the rest of it is gone. You need somebody with you. My life has changed. It has been... It's a sense of loss. It's a sense of loss of identity in a way. My feminism, the body image side of things, and financially it has been difficult. I had to give up my job, and I'm not able to go back to a responsible post. I'm working part-time at the moment, and I have to say it was very difficult to find another job. It's difficult to think long-term, but just hold on to the fact that the treatment now is wonderful, the support you'll have is wonderful, and we just don't know what's around the corner. But it's easy to say keep positive, but I do think that helps.
I'm Paul Shalkowskis, Professor of Clinical Psychology and Applied Science. I'm also the Clinical Director of the Maudsley Hospital Centre for Anxiety Disorders and Trauma. Fears make the transition into phobias when people have to accommodate, where they have to build their life around avoiding the things that they're afraid of. And then you're really looking at a phobia. So you know you're phobic if you're starting to change your life to avoid coming into contact with the things that you fear. Phobias quite neatly divide into specific phobias, things like cats, dogs, heights. Phobias are very specific things, and generalised phobias, typically social phobia and agoraphobia. Agoraphobia and social phobia are much more disabling in most cases, although occasionally you will see people with specific phobia who are completely handicapped by that as well. But specific phobias are much easier to live with than the more generalised phobias, because you can't avoid people and you can't avoid going to crowded places under most circumstances. Specific phobias actually typically start between the ages of about 4 and 8, so most of the phobias of snakes, spiders and so on start in children, and it's a really good idea in a controlled way to actually familiarise children with the things they're afraid of, and that way we can actually wipe it out before it becomes a problem in later life. Social phobia and agoraphobia start much later, so social phobia starts at puberty, and then agoraphobia starts usually